I'll just be talking about one of my research projects, looking at discontinuation and non-publication of cerebrovascular clinical.
Can you make sure you speak up loudly, please?
Oh, yes, sorry. So obviously we all know that they're very prevalent diseases, particularly stroke. It's the most common life-threatening neurological event in the United States, and in developing nations worldwide, it's cited as the third most common cause of death, and then like the fifth most common cause of death in the United States currently. Big public health burden, and expensive to treat and take care of these patients because of the prevalence. So, studying cerebrovascular diseases through clinical trials, it's essential for advancing our knowledge and improving patient outcomes. Clinical trials are considered the gold standard for evaluating health interventions, but they require significant financial resources. There was a study of trials from 2015 to 2017 estimated a median cost of over $40,000 per patient. And so thinking about like waste and inefficiency and how the research is conducted is important because those factors can exacerbate this. So clinical trial discontinuation, specifically for reasons not related to safety or efficacy, we know that those things, happen sometimes. And non-publication can contribute to research waste, and they've been shown to be prevalent in the general research population, as well as in other specialties. There have been studies that have estimated that up to 85% of investment in biomedical research is wasted through inadequate production and reporting of results. So there are methods for this study. So we did a retrospective cross-sectional study of clinical trials in the clinicaltrials.gov database. So this is just an online database provided by the National Library of Medicine. It's the largest primary registry in the World Health Organization International Clinical Trials Registry platform. And one thing about this registry that's nice is they have an automated term mapping capability. To capture all the trials related to cerebrovascular disorders that we wanted to, we used previously published search terms and reproduced those, and then also captured studies based on the term mapping capability of clinicaltrials.gov registry. So inclusion criteria for this, obviously clinical trials related to cerebrovascular disorders. We did exclude stroke studies that were primarily related to cardiovascular disease or rehabilitation. And then we did not include phase 1 or phase 2 trials. We did include combined phase 2 and 3 trials, but specifically focused on phase 3 and 4 trials because these are designed to evaluate, prolonged outcomes in humans and more likely to reach publication. So for trial status, we included completed trials and then withdrawn and terminated trials, excluded active trials, so recruiting, not yet recruiting, enrolling by invitation. These trial statuses are all listed on clinicaltrials.gov, so you can sort by those. And then we excluded trials that were completed after May 7th, 2021. That was just 3 years prior to the day that the search was done. And we did this to allow for 3 years from trial completion for publication. So this is kind of just a flow chart, just showing the search process and how we've identified the studies. So we had 2,100 search results, and we removed duplicates, and then there was about 1,300 trials that we identified. So we went through each one of those and excluded them based on the criteria that I just talked about, and we ended up with 422 trials in our sample. So we analyzed each listing to identify publication status, reason for discontinuation of the discontinued studies, the funding source, intervention, location, enrollment, start date, completion date, and then if there were any results posted or linked publications to the listing. And then we did a search for associated publications using PubMed and based in Google Scholar, using the title of the trial, investigator names, and the national clinical trial number, which is unique for each trial. So in terms of grouping, so all trials that had a completed status formed the completed group, and then trials that had a status of terminated or withdrawn were the discontinued group. And then we consider publication of trials to include obviously publication in a traditional peer-reviewed journal, but also presentation of findings at a national or international conference with abstracts available online. For data analysis, we calculated the unadjusted and adjusted binary logistic regression to determine the association between completion and publication status and trial characteristics. So for this model, our variables were trial status, and publication status, and funding source, intervention type, and location of trials as variables. So like I said, we had 422 included trials. About 75% of these investigated pharmacological agents or drugs. Medical devices and procedures were the next most common intervention types. Most trials were funded by a hospital or university, followed by industry, and then smaller percentages of private investment, government, NIH, and nonprofit organizations. Then in terms of location, about 75% were conducted internationally, and 25% were conducted in the United States. So completed versus discontinued trials, we'll talk about that first. So it's about half and half. 243 were completed and 179 were discontinued. We found that trials investigating medical devices as well as government funded trials had lowest rates of discontinuation. And then in terms of location, there were similar rates of discontinuation between trials conducted in the US and internationally. So this is just a slide kind of showing the location where completed and discontinued trials were most commonly performed. China and the US was most common in both. So this slide talks about the identified reasons for discontinuation. So these were reported on clinicaltrials.gov, and you can see that 100 of them were reported no reason for discontinuation. Of the reasons identified, difficulties with enrollment and recruitment were the most common. And some of these are like this one here, sponsor funder problems and slow enrollment and recruitment. The second line, that was, that included recruitment difficulties, but they also reported having sponsor and funder problems. So, and that was kind of just an example. We just reported what they listed there. And another note that I wanted to make is futility. If a trial reported being discontinued for futility, we still included that in the discontinuation group because that's the status that's on clinicaltrials.gov. We analyzed that data with those in this group, but there were 14 of those that were discontinued for futility reasons. So now looking at published versus unpublished trials, 52.8% were published and about 47% were unpublished. About 80% of the discontinued trials were not published. And then for the completed trials, about 75% of those were published. And so discontinued trials we found were more likely to be unpublished. And this is again a similar graph looking at the location between published and unpublished trials. We can see China and the US are still pretty prevalent. And then there were over like 20 different countries that make up these like other in the green here. So conducted in a variety of locations. This is sort of talking about the data from the logistic regression that I did. So trials investigating medical devices and a combination of devices and drugs were less likely to be published. The adjusted odds ratio here, as well as for the adjusted odds ratio for device and drugs. So there were no other statistically significant associations that we found with the logistic regression, but those two were significant. So this is a graph here of publication of trial results by completion year, starting with the earliest trial reported on clinicaltrials.gov. So obviously there's, it's been, going up over the years. This last line here, 2021 to 2024, because we excluded completed trials or trials that were completed in the past 3 years, that's why this one is a lot lower. But these trials come from, if we found that a trial was completed at some point, but was initially in the discontinued group, we still include that in our sample. So this is made up of a lot of those trials. So just kind of a summary of the key points that we found in the study so far. So premature discontinuation occurred in about 40% of cerebrovascular trials, most commonly for unknown reasons, but slow enrollment and recruitment difficulties was the most commonly identified reason. There have been studies that looked at, recruitment failure specifically in clinical trials, and they concluded that it's often for preventable reasons. So I think from this, implementation of targeted strategies may decrease the discontinuation rate in future studies. And so I think something that should be looked at closer. And then in terms of publication, about half of all the trials were unpublished, particularly among discontinued trials. And that's been something that was also found in similar studies in other specialties and in clinical trials in general. But I think it's, important because discontinued trials still have value to, the research community, and there's things that we can learn from them, whether or not they were completed. So just some limitations of the study. The clinicaltrials.gov registry, it's the data on there is mainly reported by investigators and sponsors, so there's not always possible to verify the accuracy of that data. And then although the registry is pretty comprehensive, it might not include all clinical trials worldwide, so there's possibly some that were missed. And then because we use keywords and the term mapping capability to locate trials, it's possible that some were missed in the search process as well. So next steps and things that I'm still working on with this project, contacting the investigators of the trials to identify reasons for discontinuation if they were discontinued, and then also confirming the publication status if I wasn't able to find a publication, and then importantly looking at the reasons for non-publication in studies that were indeed non-published. So that's what I'm working on currently, and hopefully that will be finished up soon. I want to just thank Dr. Rahimi and Dr. Galzani at my home program. They helped with this project. And that's it, and I'll take any questions.
So the implications, I guess, are that if you might be doing something somebody else has already done and you didn't know was done, and so you never find out. And so how can we make that better? What's the solution? And how much money do you think this is costing us in lost repeat studies? You got some idea for the volume that is involved here?
There was a study in 2010 that looked at sort of this waste that I'm talking about, and I think they estimated it was like $50 billion or something, equivalent of basically how much money was wasted by these, either not in a combination of not publishing the results and then also, stopping a trial early for, preventable reasons. So definitely quite a significant amount of money, but yeah, I think that's one important thing. That's, like I said, the trials that were discontinued early, they still have value. And that's one thing is, if you have the question, someone else probably does too. And so I think, knowing what other people have done is important, even if,
So should we make it this, if you're going to do this, should we make that mandatory that you have to publish the results? How would you get around this, in other words?
I think that's, it's not necessarily, just for example, I did a similar project in neuro-oncology trials, and I did the next step in that where I identified the reasons for non-publication, which I plan to do in this trial. But one of the things that I identified was, not uncommon for, investigators to say that they had submitted the paper and it was just not accepted, or, things of that nature. And so I think that's, I think it should be published for sure, but there are a lot of factors that go into that.
Thank you very much.